This is the brief on treating severe alcohol-related liver disease. So, a recent study of over 1,300 patients waiting for liver transplants just revealed something totally massive. A wildly underused treatment, MADS, or medications for alcohol use disorder, is actually a huge lifesaver. Avoiding these addiction meds for severe liver patients is kind of like having a fire extinguisher during a kitchen fire, but being too afraid to use it because you're worried the foam will damage the stove. Why are we holding back on treatments that could save lives? First, we got to look at the core of the problem. Alcohol-related liver disease is the leading reason people need liver transplants in the US, but meds to treat the underlying alcohol use disorder are barely ever prescribed. It's mostly because doctors just lack the clinical knowledge regarding their benefits for patients who are that sick. Second, we finally have the data to prove this works. When patients stayed on these meds for at least 3 months, the results were absolutely staggering. Survival rates jumped 6.6% after 1 year and a massive 18.5% at the 3-year mark. Now, you might be wondering, doesn't how sick they are or where they are on the transplant list matter more? Well, interestingly, no. The survival benefit held up completely independent of their end-stage liver disease score or their transplant status. Finally, this proves that pharmacotherapy, meaning actively treating the addiction with medication, absolutely should be considered even for the most severe cases, highlighting a real desperate need to improve access to these drugs. Ultimately, treating the addiction with medication isn't just about changing habits, it's a critical life-extending intervention for failing livers.